Hi, my name is Dr. Scott Katzman, and I am a spine surgeon that specializes in very unique and minimally invasive techniques for the spine. One of the procedures that we do very often is a artificial disc replacement for the neck. Who's a candidate for that? Well, if you have a herniated disc or if you have arthritis to your neck, which is very common, most doctors in the United States that do spine surgery will take that disc out, take out your bone spurs, and then they put in a device that's a spacer with a plate and screw. That unfortunately makes your neck more stiff, and it creates a second problem. What we do is we put a moving part in. That would be called an artificial disc. It's a better procedure, so you don't need to have to wear a neck brace post-operatively. It's less blood loss. There's a small incision required. It moves so you don't lose motion. And most importantly, it doesn't cause stiffness to your neck to wear down the other bones in your neck. And so what happens is when you fuse your neck, which is the procedure that most people do for that neck problem, is you lose motion, but the other segments try to move to overcome it, and then they wear down, and then you have to have more surgery. So this saves you from that problem. Additional treatments that we do that are very unusual is for people who have coccyx fractures and coccydynia, chronic innate time. We fix those. We do Coccyx-Injectamies. We're one of the few places in the United States that does Coccyx-Injectamies. We're also the largest facility or group in the United States doing the artificial disc replacements. Both those two procedures we specialize in. We do minimally invasive surgery whenever we can, which allows about 90 to 95% of our patients to go home the same day. For low back problems, we do minimally invasive procedures. If you have a herniated disc in your low back, we do minimally invasive procedures with a small incision about the size of a pea up to a size of a nickel. And through that small hole, we can take the disc out and fix your problem. It's minimally invasive outpatient, and you're able to go right back to work a couple days later. For more serious back problems, when you have to have something else done, we do artificial disc or we do fusions to the back. And those, we also specialize in doing it minimally invasive and with just a overnight or outpatient procedure. Yeah, for patients that are skeptical about a particular procedure, first you have to make sure that you really need it. In order to know that you really need it, you obviously have to have symptoms. You have to have either numbness, tingling, weakness, or severe pain. Assuming those all exist and the problem's been chronic and nothing else has helped, like medication, therapy, and injections, then fixing it becomes very reasonable and necessary. We get patients who are very severe and they become like what they call myelopathic, where they can't walk or they stumble and they fall. Those patients need surgery right away. One of the other things that we specialize in, which is very rare in the United States, is that if you have a neck procedure done on you and it's failed, we specialize in revising that procedure to make it successful. Most neck procedures fail because there's a non-union, that is to say that the bone that's put in never fuses and it's loose and you have to take it out and redo it. We specialize in that, and usually we're able to put in a moving part, an artificial disc, in that situation. Not all the time, but usually we are, and that's a very rare thing. All these things help patients' outcome. They allow for more motion, they allow for quicker activity, less pain.